Do you feel like the vitality, strength, and confidence that defined your youth are waning? Men listening, if you think that challenges in your intimate performance are just an inevitable consequence of age, I tell you today that you're wrong. The real problem we face after 60 isn't age itself. It's the silent buildup of internal acidity, the chronic inflammation that blocks circulation, and the wear and tear on your body's metabolic engine. I'm Dr. Elena Castillo. I've been working with older men for decades, not only treating symptoms but also searching for the roots of longevity, fulfillment, and the undeniable right to maintain a satisfying intimate life. I understand the frustration and worry that this stage brings, and I want to tell you that I am your ally in this quest for well-being. Today, we're going to talk about an ally so humble that you probably have it stashed in your pantry, something as basic as baking soda. Yes, you heard me right. This white powder has 10 surprising and proven benefits that go far beyond cleansing, directly impacting the quality of your circulation, the delivery of oxygen to your tissues, and, crucially, your energy and intimate performance after age 60. Forget expensive magic bullets. My mission is to give you back the power of your own health through accessible tools. Stay with me, because what we're about to discover about baking soda can change not only your mornings, but also your nights. I know some of you are thinking right now, Dr. Baking Soda? That's for cleaning the refrigerator or relieving indigestion. How can that possibly be related to my physical or intimate performance? I understand your skepticism. We've been conditioned to believe that important solutions must be complex and expensive. But let me take you a step beyond what advertising has taught you. The key is understanding the physiology of aging. The science is clear. As we age, our bodies tend to slip into a state known as low-grade metabolic acidosis. This acidity doesn't feel like a burn, but rather like constant fatigue, slow recovery, and, most relevant to us today, as the silent enemy of your vascular health. Think of your arteries. If the internal environment is constantly acidic, the walls of those vessels become stiff and inflamed. This impedes the proper functioning of nitric oxide, that miraculous molecule responsible for vasodilation, crucial for blood to flow freely and nourish all tissues. When acidity affects the endothelium, the inner lining of your vessels, blood flow to the pelvic area is restricted. This is the main challenge facing men over 60. This is where our humble and economical ally comes in. Sodium bicarbonate is, in essence, a potent alkalizing agent. By taking it in a controlled manner, you are not only relieving the burden on your kidneys, but also correcting the acid-base imbalance and drastically improving the internal environment of your blood vessels. An alkaline environment promotes arterial elasticity, allowing the arteries to relax, vasodilate, more efficiently. For your intimate performance, this is no small detail. It's the difference between sluggish, restrictive blood flow and the ability to deliver the volume and pressure necessary to regain and maintain vitality. We're talking about improving oxygen delivery to every cell, reversing the silent wear and tear we've accepted as normal. Let me use a very simple analogy to help this pH concept sink in. Think of a chronically acidic environment as trying to move honey or thick syrup through a narrow pipe. The flow is slow, requires a lot of pressure, and leaves a sticky residue. In contrast, when the body shifts toward an alkaline balance, the blood flows like clean, clear water. This change, although microscopic in terms of total blood pH, has a monumental impact on the function of your endothelial cells. Science has repeatedly shown that, in an optimal alkaline environment, the bioavailability and effectiveness of nitric oxide is enhanced. This molecule, key to erectile health, is extremely sensitive to acidity. If the environment is hostile, acidic, its ability to relax the smooth muscles of the arteries is compromised. Sodium bicarbonate acts as a biological buffer, ensuring that nitric oxide can do its job unhindered. When you improve arterial elasticity and optimize nitric oxide signaling in the pelvic region, you are directly improving the quality and durability of your physiological response. It's no longer just a temporary increase in flow, but a progressive recovery of vascular function that had been lost due to years of metabolic imbalance. Recovering vascular elasticity means your arteries will relax more completely and quickly, allowing the blood volume necessary to regain and maintain firmness. We're talking about laying the biochemical foundation for the body to vigorously perform its natural functions, reversing the silent wear and tear we had accepted as inevitable. The benefit is systemic, but it manifests itself very tangibly in your intimate performance. If nitric oxide is the architect who opens the floodgates, hemoglobin is the transport vehicle for the vital energy, oxygen. We must understand that a strong, long-lasting erection isn't just a matter of blood volume. It's a matter of the quality and efficiency with which that blood nourishes the erectile tissue. The corpus cavernosum tissue, being thickened and under pressure, demands a high metabolic rate, which means it needs constant oxygen to sustain muscle function and avoid fatigue. It's here that sodium bicarbonate exerts its most fascinating influence at the molecular level, a process well known in respiratory physiology. Think of it this way. The hemoglobin in your red blood cells loves oxygen and traps it tightly in the lungs. However, for the erectile tissue to receive that oxygen, hemoglobin must be willing to release it exactly where there is high metabolic demand and, therefore, greater localized acidity due to the production of carbon dioxide as waste. If your blood is chronically unbalanced toward overall acidity, hemoglobin becomes stingy with its cargo. It holds oxygen too tightly. By gently optimizing blood pH with bicarbonate, we're adjusting that delicate balance. We're creating an environment where hemoglobin becomes much more sensitive to oxygen demand signals coming from the tissue it's working on. Bicarbonate, by buffering systemic acids, ensures that when the erectile tissue screams for oxygen, by increasing its acidity locally, the hemoglobin hears it loud and clear and releases its cargo completely. This more efficient and rapid delivery of oxygen to the penile tissues translates directly into greater metabolic stamina and firmness that can be sustained longer, mitigating the rapid decline effect many men experience. It's a fundamental improvement in cellular delivery capacity, which is the foundation of tissue vitality. We've talked about the efficiency of oxygen delivery, but now we must consider the health of the highway along which that oxygen travels. Your blood vessels. Chronic inflammation, that low-grade internal battle that doesn't produce fever, is the most devastating silent enemy of male performance. When the vessels that supply erectile tissue are chronically inflamed, they become stiff and lose their essential capacity for vasodilation. That is, they lose the ability to open fully, quickly, and sustainably when the body sends the erection signal. Many men see this as a sudden failure of performance, but it is, in fact, the delayed manifestation of years of metabolic stress and systemic acidosis. Erectile dysfunction is often the canary in the coal mine, warning us of a broader and deeper vascular problem. Bicarbonate intervenes here as a molecular peacemaker. By buffering the pH, we are not only optimizing the blood environment, but we are also reducing the constant irritation suffered by the endothelial cells, the delicate inner lining of your arteries. Think of it like cleaning the pipe before corrosion becomes permanent. A less acidic environment results in less activation of key inflammatory pathways, such as NF-κB, which is the command center of the cellular inflammatory response. By calming this response, we allow the endothelium to function as it should, producing vital nitric oxide, the main player in smooth muscle relaxation that facilitates optimal blood flow. Imagine nitric oxide as the chemical messenger of relaxation. Its primary function is to signal the smooth muscles surrounding the cavernous arteries, the main vascular structures of erectile tissue, to fully relax. When that signal is strong and clear, the bloodstream can flow without resistance, a controlled flood that culminates in the necessary firmness. But here comes the crucial point and the reason why many men experience intermittent failure or a gradual loss of rigidity. Nitric oxide is an extremely sensitive and fleeting molecule. It's very vulnerable to oxidative stress, those free radicals we mentioned that thrive in an acidic and inflamed body. If the internal environment is prone to oxidation, the precious nitric oxide your body produces is quickly neutralized and destroyed, often before it can complete its vasodilatory work. It's as if the messenger arrived at the door, only for his message to be stolen and incinerated before being delivered to the recipient. This is where sodium bicarbonate, through pH optimization, offers vital double protection. First, as we've already established, by reducing systemic acidity and chronic inflammation. It allows endothelial cells, which are the producers of NO, to operate in optimal conditions. They are less stressed and can synthesize nitric oxide more abundantly and efficiently. But the second layer of benefit is equally fundamental. By creating a less acidic and therefore less oxidative metabolic environment, bicarbonate acts as an indirect shield that protects the nitric oxide molecule once it has been released. We are, in fact, prolonging the lifespan and effectiveness of NO. Not only do we ensure that the factory, the endothelium, operates at its maximum capacity, but we also guarantee that the final product, nitric oxide, is stable and can reach its vascular destination without being degraded. It is the chemical maintenance that enables a powerful, acute vascular response, even with the passage of time, cementing a resilient and long-lasting vascular architecture. This comprehensive approach is what distinguishes metabolic optimization from short-term palliative solutions. Now, I want to shift our attention from vascular architecture to the true pillars of body cleansing and balance, the liver and kidneys. These organs are our internal waste management systems, and their ability to function optimally is directly proportional to our long-term health, especially as we age. The first point to understand is the tremendous burden that chronic metabolic acidosis imposes on the kidneys. They are the master regulators of blood pH. To counteract the constant influx of metabolic acids generated by diet and stress, the kidneys must work tirelessly to reabsorb lost bicarbonate and, more crucially, synthesize and excrete large amounts of ammonia to neutralize the acidic protons. This is a metabolically very costly process, and, over the long term, can contribute to kidney fatigue, progressive nephron loss, and ultimately the development or acceleration of chronic kidney disease. When we introduce sodium bicarbonate into the equation, we're giving the kidneys a strategic and much-deserved break. We're providing them with the alkaline buffer they would otherwise have to laboriously synthesize, freeing them from their most draining function. It's like paying off an accumulated debt so they can focus on their other vital tasks, such as electrolyte management, hormone regulation, and blood pressure homeostasis. By reducing the acid load, we not only protect the kidney structure, but also improve its overall efficiency, ensuring these vital organs can perform their work of filtration and excretion without prematurely exhausting themselves. But detoxification goes beyond acid management. The liver is our chemical processing plant, responsible for neutralizing endogenous toxins, such as hormonal waste, and exogenous toxins, pollutants, drugs. A key function for the elimination of these fat-soluble wastes is the production and flow of bile. Bile acts as a vehicle that transports toxins out of the body through the digestive tract. A slightly alkaline metabolic environment, induced by bicarbonate, is critical for this liver function. When the body operates under a state of acidity, bile tends to become thicker and more viscous, a phenomenon known as cholestasis. This stagnation of bile not only makes it difficult to digest fats, but also delays the elimination of toxins already processed by the liver, potentially allowing their reabsorption. Sodium bicarbonate acts as a mild choleretic, promoting smoother bile and a more robust and consistent bile flow. This optimization of bile flow has direct repercussions on our overall metabolism, and this is where we connect with one of the most sought-after benefits, supporting weight loss and reducing sugar cravings. Metabolic acidosis not only stresses the kidneys, but is also a chronic stress factor at the cellular level that affects insulin sensitivity. When the body constantly struggles with low pH, the cell's ability to receive and respond to the insulin signal is compromised. This results in more erratic blood sugar levels. We experience sugar spikes and crashes, which are truly responsible for those uncontrollable cravings for simple carbohydrates and sugars. The body, in its desperate search for quick energy to compensate for cellular dysfunction, pushes us towards sweets. By using bicarbonate to buffer this acidic load, we are calming the cellular environment and improving insulin response. We are not directly targeting insulin, but rather eliminating the metabolic noise that interferes with its functioning. The result is a more stable blood sugar curve and therefore a noticeable decrease in the compulsive need to consume sugar. But bicarbonate also plays a subtle but powerful role in managing abdominal weight through hormonal pathways. We must understand that visceral fat, the fat that accumulates around the waist, is not just an inert energy store. It is an active and dysfunctional endocrine organ. This fat has the unique ability to produce and express an enzyme called aromatase. The function of aromatase is to convert androgens, such as testosterone, crucial for metabolic health in both sexes, into estrogen. The more abdominal fat there is, the more aromatase is produced. This creates a vicious cycle of relative estrogen dominance, which in turn stimulates the body to store even more visceral fat, sodium bicarbonate, by promoting a less inflamed internal state and aiding in the efficient elimination of hormonal waste through fluid bile, as we discussed earlier, helps to interrupt this cycle. We are addressing the root of the metabolic dysfunction that perpetuates hormonally mediated weight gain. But bicarbonate's action on the hormonal environment doesn't stop at indirectly modulating aromatase. Its true power lies in how it optimizes the environment at the cellular level. We're talking about the sensitivity of testosterone receptors. We must understand that it's not enough to have enough hormone circulating. The key lies in the efficiency with which that hormone can deliver its message to the cell. Think of testosterone as a key and its cellular receptors as locks. No matter how robust the key production is, if the locks are rusted, deformed, or filled with metabolic debris, the key won't turn and the hormonal message won't be delivered. Chronic low-grade inflammation and metabolic acidosis act precisely like that dirt and rust. When the extracellular environment is persistently acidic and inflamed, the cell membrane becomes rigid and hormone receptors, including those crucial for testosterone, thyroid, and vitamin D, become desensitized or partially blocked. The body may be producing adequate amounts of testosterone, but if the message can't enter the cell, we experience deficiency symptoms, loss of muscle mass, resistance to weight loss, chronic fatigue, low libido, and difficulties with physical recovery. By using bicarbonate to neutralize excess acidity and reduce the systemic inflammatory burden, we're helping to restore the fluidity and integrity of the cell membrane. Essentially, we're clearing and lubricating those biological locks. This allows the receptor to deploy properly and improve its affinity for the circulating hormone. We're making a normal dose of testosterone, in both men and women, more effective at the cellular level again. This is a profound optimization approach, improving hormonal communication that is critical for maintaining a lean metabolism, bone density, and sustained vitality. We've reached the end of this in-depth analysis, where the key isn't blindly boosting a hormone, but rather optimizing its environment of action. Remember, sodium bicarbonate acts as a pH balance restorer, clearing away the metabolic gunk and allowing your hormone receptors, especially those crucial for testosterone, thyroid, and vitamin D, to regain their peak sensitivity, transforming a normal dose into more effective cellular communication and promoting sustained vitality. The question I leave you with is, how do you plan to integrate this approach to cellular optimization and pH balance into your daily routine to restore your energy and well-being? If this information has been useful to you and you'd like to delve deeper into the science of longevity and metabolic wellness, please give it a like, subscribe to the channel, activate the notification bell, and share this knowledge with those who need it most. Thank you for joining me on this journey of deep bio-optimization. With my commitment to science and health, yours, Dr. Elena Castillo, bids farewell.